Okay, we're on. Hi, Erin.
Hi, Sarah.
Thank you for being here. As everyone knows, probably at this point, after it's 16 days into March, I am doing a mouth breathing awareness campaign, and my goal is to bring awareness to mouth breathing because it's connected to so many other bigger symptoms and problems. As a myofunctional therapist, I see my patients who struggle with mouth breathing and a lot of other myofunctional issues. And it's one of those things that I feel like is so severely underdiagnosed and underrecognized, not only by healthcare providers and dental providers, but by patients themselves. So my idea was if I could connect with all of these amazing people that get to go through my MyoMentor program and that I'm lucky enough to meet. Um, I hear their stories all the time, but I would like other people to be able to hear their stories. So that's what we're here for today. So I've got Erin Ullman. She's from Battle Creek, Michigan. She's a hygienist and a myofunctional therapist. And I would love it if you could share your story and kind of talk about how you got started in this field. I know you were telling me beforehand that, you're like, my story's not really that big, but I think that's kind of the point, right?
I think so.
Yeah, good. So go for it.
I've been doing dental hygiene for almost 20 years now, and I didn't know what myofunctional therapy was until just a few years ago. I had heard a couple different added a couple different CE courses. I'd heard Doug Thompson and Whit Wilkerson mention myofunctional therapy and thought, what is this? I got to look into this. I knew it was something a dental hygienist could do. And my boss said, yeah. He said, look into that and see what's going on with that. He said, if that's something that you're interested in pursuing, he said, I would totally support that. And so I did. I looked online to find some courses and I really didn't know what it was. I just thought, oh, I'll figure it out as I go, which I did.
Yeah.
I found you online among other things. I found what you had to offer through your MyoMentor program just really seemed to be the best fit for me. A slower
Awesome.
pace and a lot of personal contact just really seemed like what I was looking for, and has really worked out well and helped kind of launch me into this.
Yeah. And actually, we should give your dentist a little shout out because it's amazing how supportive he's been and how he's like wanted you to do all this stuff and like, hey, if you want to do it, let's do it. So he's Dr. Robin Steely, right?
Yes, I feel so fortunate to have learned about this while I've been working with Dr. Steely, because he really has been so supportive. He's all about whole body health, and he's a lifelong learner. And so he really just has supported this wholeheartedly. And it's really kind of opened some new doors for him too, where he's learned about a lot of different avenues that he can pursue, and has really changed a lot of the things we're doing in our whole office.
Yeah, I love that because all these stories with the hygienist and the dentist teaming up and working so well together, that makes me so happy because we tend to, especially with this COVID situation, there's a lot of tension and fighting and stuff online. And I know from my experience, I work with a lot of amazing teams of dentists and hygienists who are like all about uplifting and promoting and like working together, uplifting and promoting each other and working together. So anyway, just a side note there. I thought that would be worth mentioning.
Yeah, absolutely. Um, so that was how I got started. After taking your course, I just kind of dove right in. I saw my first patient through your matchmaker program, which was incredibly helpful to me. Gave me a lot of confidence
Good.
seeing my first patient, to kind of feel like I was kind of under your little umbrella, under Sarah's wing.
Totally.
um, so as I learned about myofunctional therapy through taking your course, of course, little light bulbs start going on, both the things that I notice in my own habits and health and in the patients that I see every day in my office, thinking,
Yeah.
oh, we just learned about this and I see this in this patient and I know it could be connected to this and this and this. And I would ask patients. I had so many patients that as I was doing their oral cancer screening, and I would say, do you snore? And they would say, what did you just see in my mouth that made you ask me if I snore?
That it does seem kind of funny, but
And that's such a great response. I love it when patients say that, because it just opens a door for me to tell them what I saw and how that's connected to some of the symptoms that they wouldn't have connected before.
Yeah. So just for some of the patients who might be listening, what do you see? Like what's a little red flag for you when you're doing that oral cancer screening?
Their Mallampati score, which for people who don't know what that is how much of the back of your throat is visible when you open your mouth wide. Can you see all the way to the back? How much of that space does your tongue fill? The more space that your tongue fills, the less air can get to the back, the more likely you are to be a snorer and possibly have sleep apnea. So looking at that kind of a thing, looking at tonsils, looking at the tissue around their gums, red inflamed tissue is common for people that are mouth breathers, which is also common for people that are snoring.
For sure.
Like that.
Yeah, I love the analogy Dr. Zaghi uses, and I know you've been to one of his courses too, but he talks about it, it's like a continuum. So it's mouth breathing at one end and then obstructive sleep apnea on the other. And somewhere along the way, you go from mouth breathing to noisy breathing to snoring to upper airway resistance issues, syndrome, and then to finally obstructive sleep apnea. But there's all this spectrum and continuum along the way. And so if people snore, it's so important to know that if they don't address it today, there's a lot of potential for it to just keep continuing and get worse. So
yeah. I think does Dr. Zaghi say, or maybe you said it in our class, that a mouth breathing child becomes an adult with sleep apnea.
Yeah, I say that a lot, and I know Dr. Zaghi says it a lot too. Yeah, the mouth breathing kids are the adults we see with sleep apnea if it's left unaddressed and not corrected and not recognized. So yeah.
And how many children are being diagnosed even now with sleep apnea? It's not even manifesting all the way into adulthood. We're seeing so many children with sleep apnea.
True. Yeah, for sure. So in the beginning, before we started, you were saying, well, my story is not that big. And I think that's actually what's cool about it, because a lot of these symptoms are subtle and you don't have to have the chronic pain and the severe sleep apnea as an adult. So talk about kind of what you noticed and tell us what you said to me before.
Well, I felt like I wanted to have all these symptoms, like to have a story worth telling, like all these symptoms that, that got resolved through going through myofunctional therapy. But I really didn't have all of these big red flags that we do see in so many patients, of lots of symptoms of dysfunction. But I learned that dysfunction isn't only the big obvious symptoms. It's not checking off all of the symptoms on the list. Just one or two symptoms of dysfunction is still dysfunction. And for me, that was mouth breathing and low tongue posture. But again, it wasn't a big obvious thing. If you would have asked me in an evaluation if I breathe through my nose or my mouth, I'd have told you I breathe through my nose. I didn't know I was a mouth breather, but I wasn't a big gaping mouth breather. I wasn't a Napoleon Dynamite, like Kimmy said in her interview. I just had my lips slightly parted with a low tongue posture. But what I noticed about that as I began to pay attention to it was my mouth was always dry. I always needed to drink water. I always slept with water on my bedside. I didn't have poor sleep as far as UARS or sleep apnea, but I woke up in the night with my mouth so dry it was uncomfortable, and I'd have to take a couple sips of water and then go back to sleep. I would wake up one or two times a night to drink water, and of course when I woke up first thing in the morning it was on my nightstand. So just chronic dry mouth,
which as we know from dentistry, leads to increased risk for perio issues and tooth decay issues. So even if you're just looking at it from like the tiniest, the dental perspective and not the massive airway perspective, it's still a big deal. Did you notice any effects like after you started nasal breathing on your dental health? Since, you must be paying attention.
I think because of my long history in dentistry that I've always really stayed on top of that. So it wasn't anything that had kind of gone, and also I've always been a really healthy eater. So because I've had, healthy hygiene habits and healthy dietary habits, those that I wasn't kind of going down that road of periodontal disease. I do have some recession because in the past I have, been a clencher and grinder. So I do have some recession from that, but otherwise pretty good oral health.
Yeah, good. No, I can relate to that a lot too. My stuff was never bad. But I just was horrified to find out that like I was a mouth breather, and it's embarrassing when you notice it. And again, mine was just like you said, you called it a stealth mouth breather before. Like the lips are just barely apart.
Flying under the radar.
Yeah, you fly under the radar and you don't really notice it. You don't look like Napoleon Dynamite, so you don't really think of it. But yeah, as soon as the lips open, the tongue drops low. Everyone can try it. Open your mouth, the tongue goes to the bottom. So I mean, unless you've done myofunctional therapy and you've like trained yourself to suction your tongue up while your lips are apart, but that's typically not how people would naturally rest. So
right.
Yeah.
I had chronic seasonal allergies as a result of, breathing through my nose, through my mouth. But since learning all of this and retraining my habits to breathe through my nose, now that I know of all the benefits of all the different levels of air filtration we get as we breathe through our nose and the air passes through our sinuses, in addition to the increased, oxygen flow into our body, but just the filtration in our sinuses alone that filters out toxins and bacteria and viruses and allergens has made a huge difference in my life. I used to do daily allergy medicine, usually Zyrtec or Claritin, one of the 24-hour antihistamines, as well as taking the Flonase daily. And now I don't really have any symptoms of allergies as far as the runny nose, stuffy nose, sneezing stuff anymore. If I get seasonal allergies, it's just itchy eyes now, which I can usually manage with some allergy eye drops. So no more systemic medications, no more corticosteroids.
Nasal
so
spray,
that's made a huge difference in my life to not have allergies.
I noticed that in a ton of patients, and I feel like it's one of those things I don't want to like say like, oh yeah, just start breathing through your nose and your allergies will get better. But I will say I see that in almost every patient who has bad allergies in the beginning of treatment. By the end, I ask them, it's spring, how are you doing with your allergies? And they're like, oh yeah, I'm actually doing fine. I haven't had to take my medication like I usually do. And I found that personally. So I'm glad you shared that, because that hasn't come up in any of these interviews either. So
well, and I feel like that's another one of those things that just, it happens without you noticing it. It can fly under the radar and be a little thing, but those little things make a big difference in people's lives. And as I do evaluations with patients, even if they don't have all of the big red flags, all the bells aren't going off, that's one reason I really love to encourage patients to pursue myofunctional therapy, even if they just are checking one or two of the boxes, because correcting even something that's small or seems small that you didn't and may not have even noticed can make a big difference in your life and your health.
For sure. Yeah, no, I think that's such a great message. And I'm super happy that you're here sharing your story, because yeah, I mean, we can look at all the crazy big things, but some people aren't going to relate to that. And so having stories like yours to go out so that people can watch a video and realize like, oh, wow, I have chronic allergies. I breathe through my mouth, but it's only at night. Now we can actually start to help more people who don't fit into those extreme categories. So yeah. So thank you.
You're welcome.
Is there anything else you want to add, or what do you think?
I don't think so. Do you have anything else you wanted to ask me?
No, but I think, why don't we just talk about how people can get in touch with you? I know your practice is called Open Air Myofunctional Therapy. You work with Dr. Robin Steely at kind of a joint sleep myofunctional part of his practice, right?
Right.
And that's the Open Airway Institute.
Right.
Is that correct? Do you want to just
at openairwayinstitute.com.
Okay, cool. So I'll link all the information so people can find you, reach out to your dental practice as well. I mean, I think you guys are probably an awesome resource in Michigan, in the entire state, but especially Battle Creek, where you guys are located. So yeah, thank you for sharing your story. I guess we'll just wrap it up and say goodbye.
Thanks for having me on.
You're welcome. All right, have a good night.
Bye, Sarah.
Bye.